Hey everybody, it's Tom Judd, Global CE Day, and hey, I'm back here with someone we don't get to talk to very often, and I'm gonna let him pronounce his last name. This is Paolo from Iceland, and a clinical engineer. So Paolo, how are you doing today?
I'm doing very well. Thank you for the invitation.
Well, I know it's a little late at night here, so we'll keep moving. So tell us about your experience in the clinical engineering field. I know both on the hospital side and academics, and tell us about yourself.
Well, I started in clinical engineering back in 2002, and I've been doing my practice at Landspítali, which is the University Hospital of Iceland, the only hospital in Iceland, for 8 years. Then I started my academic career, and I switched into clinical engineering coaching. So basically, today, most of the staff that does clinical engineering at Landspítali are my former students, including the boss.
Very cool. So, hey, there's more to Iceland than the Northern Lights, you know? And you were saying it's also warm there now.
Yes, thanks to the Mexican stream.
Well, I mean, talk about your country a little bit and just, you know, where people live and that sort of stuff.
Well, I'm a kind of, I'm a foreigner in Iceland. However, I've been living here for more than 20 years. I'm Italian by origin.
But
Gargiulo
is...
Gargiulo, yeah, it's not
okay.
A very Viking. Yeah, Gargiulo is not a very Viking last name.
But you become a Viking. Okay.
Yeah, yes. And also recently, they found out that Vikings were not necessarily from North Europe, but also from South Europe. So I might have been a Viking.
You might have Viking blood.
My ancestry, yeah.
Well, I'm Scotch-Irish, so I'm your northern neighbor, but yeah, go ahead.
Yes, so I mean, as I mentioned before, Iceland has the unique situation of being a country of only 350,000 individuals, citizens. We have one main hospital, which is called Landspítali, and several healthcare centers. So basically, all the healthcare is concentrated at one place, and including clinical engineering. So our engineers, they do serve Landspítali, but they also support for acquisition of medical devices all the other healthcare centers in the country.
And so how far away from Reykjavik do people live? I mean, how hard is it to get healthcare?
Well, indeed, because we have many remote areas, my first project in clinical engineering was about telemedicine and remote health, that back in 2001. And because if there is a place where telemedicine is beneficial to connect people, it's just Iceland. But beside a number of services that are available today, also thanks to an improved telecommunication system that we all have been benefiting from, Iceland is quite well organized because the small healthcare centers can provide an immediate assistance. And then in case ambulance or helicopters, they can move the patient from the remote areas to the hospital.
So you guys were probably early adopters of a lot of digital health and perhaps health IT tools?
Yes, yes. I think we've been kind of pioneers of this technology. Back in '96, we were receiving a grant from the European Union, or what was the European Union at that time, called the WATS, and was the biggest existing consortium at that time for finding a telemedical solution. And indeed, Iceland was one of the main players in this consortium.
Well, you know, one of my colleagues that I think you've heard of is Dr. Yadin David in Houston, Texas, Israeli-American, been there 50 years, perhaps, not 50, 40 years. My point is that they were doing telemedicine to the state of Texas, which is very large, in the 90s, and he actually set up a telemedicine center, I mean, a national one, and all that crazy stuff. So yeah, you guys were getting it going at the same time, sounds like.
Yeah.
What's been the COVID experience in your population?
Well, we are right now experiencing the second wave. In terms of health technology, I would say, that the challenge for us was to speed up what normally requires a lot longer time in finding the right technology to get through the manufacturers, to get it to Iceland and get to be used by our clinicians. So that was the real challenge, to decide fast and implement even faster.
Sure.
And yeah, but I would say that something that is typical Iceland is the big extra energy that comes from the national spirit. So when they thought the risk of getting short in ventilators, then immediately started a big social participation in putting together the money, which perhaps allowed to do the purchase without going into the regulation, the normal regulations.
Sure. Yeah, I mean, yeah, regulation was, bent in a reasonable direction, I think, in many countries to hurry up. I mean, still have quality and safety, but get the tools there to the front lines that were needed. Yeah. I got to participate in your September Nordic Biomedical Conference, and I know you did too, Paolo. And I hope how'd you feel about it? I know there were folks from all over the world participating.
Yeah,
virtually.
Yeah. First of all, thanks for helping us in organizing the pandemic management session. I think the technically speaking, because at this point the real challenge was the technical implementation of a Congress, and from this point of view, I think we can be really satisfied. We had no technical issue at all over the Congress sessions, and was a medium participation. Normally, this is a local Congress only for Nordic countries, and of course people interested from all over the places, because today we are kind of global. But we had 75 active participants, and I think this was not so bad.
Well, in that pandemic management session you mentioned, go ahead, I'm sorry.
Yes, and in the pandemic management session, I found it very interesting, because we could invite also the leading doctor in Faroe Islands. So even getting let's say a touch. I know Pat Weyer personally. I visited him in Faroe Islands in the frame of the telemedical projects that I mentioned you before several times, and he's really an energetic guy. Basically, he is the leading health practitioner and scientist in Faroe Islands, and so it was very interesting to know what they did in the pandemic. Then we had our leading epidemiologist speaking on behalf of Landspitali, and then you giving us a perspective, technological perspective from the rest of the world, because you are so much in touch with everybody else. So I think it came out a very nice discussion, and thank you for that.
You're welcome. Yeah, so 2 physicians and that Ministry of Health individual. So the Faroe Islands, Faroe, how far away from Iceland are those? So some of us can learn some new geography today.
Yeah, well, the Faroe Islands is, you would not believe, but is the most dense country in Europe.
Wow.
Because despite the few habitants, there are, I think, 35,000 people living in Faroe Islands. The living surface, it's so small that makes Faroe Islands among the densest place in the world.
Wow. So how far away? Is that a flight or a boat ride or what?
Yeah, you would not because it are all hills, you know. It's there is very little flat surface in Faroe
Okay.
Islands. Are many islands, but they are all full, you know, filled with small hills. Indeed, they don't
Very
have
good.
even space for having animals, you know, freely eating the grass, you know. So it's a particular place. It's very beautiful.
And not too far from Iceland, yep.
And not far, it's 45 minutes with airplane.
Okay. Well, what messages do you have for the rest of the world, for your colleagues? We're so glad you are able to join us today.
Well, yes, I have a, let's say, a technical suggestion to keep things simple. And yeah, that's it's a lesson that I'm learning every day, living in a small society, but facing the same problems like in the big societies, you know. And keep things simple. It's always the first choice to take into account, and then eventually the most difficult. But if you can solve a problem easily, then it's the best possible solution.
Well, I think you've really hit on some important points. You know, we like to dive deep technically, but you know, we got to remember who our stakeholders are and our colleagues, and you know, make the difficult simple, and you know, be an important part of the team like you guys are there. So thank you for your time, Paolo.
Thank you, and good evening. Thank you for the invitation. Bye.
Good evening to you. Bye for now.